Hi, I'm Nicole, and welcome back to Recovery Connect. Our mission here is to connect, educate, and inspire individuals who are affected by the disease of addiction. Unfortunately, like many diseases, there is no cure for addiction, but there are a number of techniques to help manage and maintain a healthy mind in recovery. Today we have Dr. Mark Sylvester to discuss the use of medication and how it might help throughout your recovery.
Hi Nicole, thank you for having me on Recovery Connect. That's an excellent question. Medications in recovery comes up a lot for a variety of reasons. One, there are some medications which are FDA approved for the treatment of substance use disorders, such as alcoholism or heroin addiction. But we also use medications to treat underlying syndromes, psychiatric syndromes such as depression, anxiety, other mood disorders, or psychotic disorders. But some of the FDA-approved medications for alcoholism, for instance, or alcohol use disorder would be Camprol, Antabuse, Vivitrol, and naltrexone. Heroin addiction and opiate dependence, we also tend to see methadone, Suboxone, again, and Vivitrol that we use. Each case is unique in the risk-reward benefit of using a medication to assist in treatment.
Could you tell us more about the medications that are used to treat the underlying issues of addiction, such as anxiety and depression?
Yeah, sure. Often we see depression in substance use disorders or anxiety as a response to the use of that drug, sometimes as a predisposing factor. So we'll tend to use antidepressants such as SSRIs or SNRIs. There are some non-dependent risk anxiety medicines such as Buspar, Vistaril, Atarax that we can use situationally, but we use those cautiously as we don't want to reinforce the addictive tendency to turn to a medication to change the way that we're thinking or feeling, and ideally use some of the skills in recovery and life skills on dealing with life on life's terms. We can also use antipsychotics if they've got psychotic features of their psychiatric presentation, and a lot of off-label sleep medications as well.
And for an individual with a history of substance abuse, what medications should they avoid?
To some degree, we like to stay away from all addictive medications for anyone with a substance use disorder. So, for instance, someone with alcoholism may not think that they have a risk of using a benzodiazepine or a barbiturate class, whereas it can really ignite their addiction in a different form. So we tend to avoid the use of any potentially addictive medication. That can be stimulants, tranquilizers, the opiates, some of the hypnotics such as Ambien, and some of the sleep medications can be very habit-forming or also be abused as well.
And how long do individuals usually stay on these types of medications?
Each medication, and again, case is unique. Some have a more established clinical course. Some we still debate. For instance, methadone and Suboxone. There's ongoing discussions by the thought leaders in our community about how long a medication like that should be used. Usually it's up to each individual treatment or recovery plan, how much of that is going to be a medication-assisted portion of their treatment versus a harm reduction approach, versus maybe also treating comorbid complicating factors such as pain or the intense cravings which can come up for an addict in early recovery.
So in addition to taking medications, what do you recommend for people seeking recovery?
That's a great question, because we talk about medication-assisted therapy, and the whole point is to create a comprehensive treatment plan that usually consists of both the medications, but also psychosocial support, whether that's individual therapy, group counseling with mutual aid meetings such as AA or 12-step recovery models, Smart Recovery, Celebrate Recovery. Also, having accountability and structure that may include randomized drug testing, that may include regular visits with an individual therapist or counselor, and then also making sure that their social structure is supportive, so they're avoiding old triggers, old people, places, things that are associated with them using, or even changing their living environment altogether if that's a risk factor for relapse.
Thank you, Dr. Sylvester, for your time and expertise. It was a pleasure to have you. And to our viewers, thank you so much for watching. Don't forget to like and subscribe, and I'll see you in the next video.